Acne affects up to 50 million people in the U.S. and can have a detrimental effect on self-confidence. But even with or when it's gone, what can be left? Scars. Take a look.
My name's Aurora, and I'm 20 years old, and I have acne scars all over my face. For most of my life, I struggled with severe acne. Students at my school would make comments regarding my acne. So I would go home crying, just felt sad and ugly, and my self-esteem was really low. My mom, it was very hard because my emotions affected her, and there was nothing she could do about it. She always told me if she could, she would take the acne. I tried everything for years: creams, gels, pills, birth control. Nothing cleared up my acne. My junior year, my acne started to clear up. It was still really hard for me. I was left with the scars, and I can't hide it. No matter how much makeup I put on, no matter what I do, it's still there. Today, I'm seeing Dr. Rahimi to get the quadrifecta treatment, and I'm more excited than nervous because I hope that my scars will finally go away.
The procedure that I'm doing today on Aurora is called quadrifecta. This procedure is designed to erase the scars using 4 different modalities. Lasers, subcision, fillers, and microneedling approach the scarring from different levels to flatten the skin, remove the acne scarring, and give her beautiful complexion back. We're going to start by subcising and cutting the little bands that are pulling the skin down. The tip of this needle has a tiny little knife at it, so I go underneath the skin and I cut the little band. And then after you've released the band, you put a drop of the filler right underneath it. We just finished subcision and filler. Now we use this device called Venus Viva. Basically, 36 tiny little needles go underneath the skin. So you're doing microneedling, but at the same time, you're injecting energy underneath the skin to have Aurora make her own collagen and fill in the scars. So you can already see a little difference. And now we're gonna finish with a laser called Cool Touch CT3. You're all done, Aurora. You did fantastic. You did great. I think Aurora will be very happy with her results.
Aurora joins us now along with dermatologist and cosmetic surgeon Dr. David Rahimi. Welcome to you both. Aurora, how do you feel?
I'm very happy. I'm very pleased with the results. I'm so grateful to Dr. Rahimi. So it's thanks to him that my acne went away, and it's thanks to him that my acne scarring is going away.
You look great.
Thank you.
Now, Dr. Rahimi, I know you have a whole armamentarium, correct,
Yes.
of treatments for acne scars, and you tailor the 4 treatments you choose per patient,
Yes.
correct?
Basically, there are 4 different types of scars. There are scars called ice pick, where it looks like somebody took an ice pick and made little holes underneath the skin. And then there are scars that are called box scar, deep but indented, and then atrophic or rolling. So if you have a cyst that's been there for a long time, your body thinks there's an infection, sends in white blood cells to kill the infection, which eats away at the skin and leaves a little indented scar. Like an ice pick scar is actually the most challenging. It's sort of like taking the inside of a donut out. So we use tiny little knives and punch out the hole, stitch it together, and laser the overlying skin. But an atrophic or a rolling scar happens because there are little bands that are pulling the skin down. So we go with a little instrument, cut those bands, puff up the scar, and then put a little filler so it doesn't re-adhere.
How fresh out is she?
She's only day 4, so we did this 3.5 days ago.
So, you know, that being said, we have to keep in mind that she does have some early swelling, and that
Absolutely.
early swelling is our friend.
Yes.
That it does make things look better early on. So my next question, how long do you expect her results to last?
So as the filler that's temporary dissipates, her own body will make collagen that's permanent. And nothing is perfect. All these things give you a measure of improvement. 2 or 3 sessions over a few months are needed. But what I'm really passionate about, and I've worked on this for over 22 years, and is that acne can be treated and scars can be treated even in people of color. You know, ethnic skin scars more easily, hyperpigmentation, dark spots, light spots, but today there are new devices and new modalities that can treat people with sensitive skin and people of color.
And doctor, cost for the procedure?
It all depends on which 4 procedures we use. It can start as little as $1,500 to go to about $5,000.
And Aurora, we're just happy that you're happy with your result. Dr. Rahimi, thanks so much.